Fluoride is a mineral found naturally in rocks and groundwater. You might be surprised to know that it's actually present in many foods and drinks we consume daily. But fluoride is not just any mineral. It plays a crucial role in maintaining strong and healthy teeth. Fluoride's claim to fame lies in its ability to strengthen our tooth enamel, the outer protective layer of our teeth. This strengthening effect makes our teeth more resistant to acid attacks, which are a leading cause of tooth decay. By making our teeth stronger, fluoride acts as a shield, protecting them from the damaging effects of sugars and acids. Recognizing fluoride's remarkable benefits for dental health, many countries, including Canada and the United States, began adding it to public drinking water systems in the 20th century. This decision was based on extensive research that demonstrated fluoride's ability to strengthen tooth enamel and reduce the incidence of cavities. The move was initially met with skepticism and resistance from some communities, but over time, the overwhelming evidence of its benefits led to widespread acceptance. This practice, known as water fluoridation, has been hailed as one of the most significant public health advancements in recent history. By ensuring that everyone, regardless of socioeconomic status, had access to fluoridated water, public health officials were able to make a substantial impact on community health. The process involves carefully controlled addition of fluoride to public water supplies to achieve optimal levels that prevent tooth decay. The introduction of fluoride into drinking water led to a dramatic decline in dental cavities and tooth decay rates, particularly among children. Studies have shown that children in communities with fluoridated water have up to 40% fewer cavities than those in non-fluoridated areas. This reduction in dental issues not only improves overall health, but also reduces the financial burden of dental care on families and healthcare systems. The World Health Organization and the Centers for Disease Control and Prevention recognize water fluoridation as a safe and highly effective method for preventing tooth decay. These organizations have conducted numerous studies and reviews, consistently finding that the benefits of water fluoridation far outweigh any potential risks. They continue to advocate for its use as a key public health measure. This simple measure has profoundly impacted the oral health of millions worldwide. By reducing the prevalence of dental cavities, water fluoridation has contributed to better quality of life, allowing people to enjoy healthier, pain-free lives. It stands as a testament to the power of preventive health measures and the positive outcomes that can be achieved through community-wide initiatives. While fluoride offers undeniable benefits for dental health, maintaining optimal levels is crucial. Fluoride, a naturally occurring mineral, helps to rebuild and strengthen tooth enamel, making it more resistant to decay. However, the concentration of fluoride in drinking water must be carefully controlled to ensure it is both safe and effective. Too little fluoride might not provide adequate protection, leading to an increased risk of cavities and other dental issues. On the other hand, too much fluoride can lead to potential health concerns such as dental fluorosis, which causes discoloration and damage to the teeth. In severe cases, excessive fluoride can even affect bone health. Finding the right balance is key to maximizing benefits while minimizing risks. This balance ensures that the population receives the protective benefits of fluoride without experiencing adverse effects. Public health officials and scientists work together to determine the optimal fluoride levels in community water systems. Experts agree that the ideal fluoride concentration in drinking water for optimal dental health falls within a specific range. This range is based on extensive research and takes into account various factors including climate, water consumption patterns, and overall public health needs. In the United States, this range is typically between 0.7 to 1.2 milligrams per liter. This recommendation is designed to provide sufficient fluoride to protect against tooth decay while minimizing the risk of dental fluorosis. Health Canada, in its 2010 guidelines, recommended a slightly higher level of 1.5 milligrams per liter. This recommendation reflects the unique needs and conditions in Canada, ensuring that Canadians receive the dental health benefits of fluoride while safeguarding against potential risks. Achieving these levels requires careful monitoring and adjustments based on various factors. Water treatment facilities must regularly test fluoride levels and make necessary adjustments to maintain the optimal concentration. This ongoing process involves collaboration between scientists, engineers, and public health officials to ensure that the water supply remains safe and effective for all. Health Canada has been actively involved in ensuring the safety and efficacy of water fluoridation. Recognizing the evolving understanding of fluoride, they have consistently reviewed and updated their recommendations based on the latest scientific evidence. In recent years, Health Canada assembled an expert panel to re-evaluate the existing guidelines for fluoride in drinking water. This panel considered various factors, including emerging research on potential health effects and the evolving landscape of fluoride exposure from sources other than drinking water. Their findings highlighted the need for a nuanced approach to fluoride regulation. Section 5. Dental fluorosis, a consequence of excess. One of the primary concerns associated with excessive fluoride exposure is dental fluorosis. This condition occurs during tooth development, primarily affecting children. When young children consume too much fluoride, it can interfere with the formation of tooth enamel, leading to cosmetic changes in the teeth. In mild cases, dental fluorosis may appear as faint white spots or streaks on the tooth surface. While this form of fluorosis is generally considered a cosmetic issue with no impact on tooth function, it can raise concerns about appearance, particularly for children and adolescents. Section 6. Emerging concerns fluoride and neurocognitive development. In recent years, there has been growing interest in the potential effects of fluoride on neurocognitive development, particularly in children. Some studies have suggested a possible link between higher fluoride exposure and subtle changes in cognitive function, including IQ scores. It's important to note that the research in this area is still evolving, and the findings have been mixed. Some studies have reported associations between higher fluoride levels and cognitive differences, while others have not. More large-scale, long-term studies are needed to understand this complex issue fully. Section 7. Navigating fluoride intake practical tips. Given the potential risks associated with excessive fluoride exposure, it's essential to be mindful of fluoride intake from all sources, especially for infants and young children. Fluoride is found in various everyday items, including drinking water, toothpaste, and even some foods. Parents should be particularly vigilant about the amount of fluoride their children are exposed to, as young children are more susceptible to the adverse effects of excessive fluoride. While community water fluoridation programs are carefully managed to maintain optimal levels, individuals can take additional steps to control their exposure. Attending local community meetings about water quality can provide valuable information and allow you to voice any concerns. Additionally, using water filters that reduce fluoride levels can be an effective way to manage your family's fluoride intake. One of the simplest yet most effective ways to manage fluoride intake, especially for children, is to use fluoride toothpaste cautiously. It's important to supervise young children while they brush their teeth to ensure they use the correct amount of toothpaste and do not swallow it. Teaching children to spit out toothpaste after brushing can also help reduce fluoride ingestion. For children under 3 years old, using a tiny smear of fluoride toothpaste the size of a grain of rice is sufficient. This small amount is enough to help prevent tooth decay while minimizing the risk of excessive fluoride ingestion. Parents should also be aware of the fluoride content in their local water supply and consider using fluoride-free toothpaste if necessary. For children aged 3 to 6, a pea-sized amount is recommended. This amount strikes a balance between providing adequate fluoride to protect against cavities and reducing the risk of dental fluorosis. Encouraging good oral hygiene habits from a young age, such as brushing twice a day and regular dental checkups, can help ensure your child's teeth remain healthy and strong. Section 8. The future of fluoridation, adaptive management. As with any public health intervention, the management of fluoride in drinking water requires an adaptive approach. Scientific understanding is constantly evolving and new research emerges, prompting a need for ongoing evaluation and adjustment of existing guidelines. Health authorities, including Health Canada, play a crucial role in this process. By continuously monitoring the latest scientific evidence, engaging with experts, and considering the evolving landscape of fluoride exposure, they can make informed decisions to ensure public safety. Section 9. Conclusion: embracing evidence-based decisions. The debate surrounding fluoride in drinking water highlights the importance of relying on sound scientific evidence when making public health decisions. While fluoride offers clear benefits for dental health, it also carries potential risks, as with any substance. Striking the right balance between maximizing the benefits of fluoride while minimizing potential risks requires a nuanced and evidence-based approach. By staying informed, engaging in open discussions, and advocating for ongoing research, we can ensure that public health policies reflect the latest scientific understanding and prioritize the well-being of all members of society.